So we'll continue our discussion regarding vitamins. Okay, so we'll focus on today we'll focus on the water soluble vitamins. Okay, so we're done with fat soluble vitamins. Okay, so first is thiamine or vitamin B1. So it is an essential vitamin, meaning you need to get it from your diet because your body is not capable um, of forming it or producing it. Then another thing about thiamine, it is a water-soluble vitamin, so meaning it's easily removed or excreted from our body. Okay, so that's water-soluble. So it's difficult for us to have hypervitaminosis B1 or excessive amount of water-soluble vitamins because it's easily removed, okay, by our body. Okay. So for vitamin B1, deficiency is common, but uh, accumulation or hypervitaminosis B1, it's not that common. Okay, it's rare because our body is capable of removing the excess amount of vitamin B1. Okay, now regarding sources, you have liver, eggs, cereal, wheat, rice, meat, nuts, brewer's yeast. Now, regarding wheat and rice, this pertains to the wheat or rice with kanang napa siya covering, okay? Not that refined because if rice is very refined, then uh, that rice does not contain any amounts of B1 or vitamin B1, okay? So refining the grains result to deficiency in thiamine. So if you refined, okay, the wheat and rice, you're removing vitamin B1. Okay, so refining can cause deficiency in thiamine. Okay, so common cause of vitamin B1 deficiency is eating white refined rice. Okay, white rice, refined white rice. Okay, so there's complete removal of the covering that contains B1. And that covering contains B1. Okay? So regarding vitamin B1 deficiency, that's the cause of biribiri. Okay? So remember, when I say biribiri, that's vitamin B1 deficiency. Okay? So function, it's a cofactor in biochemical reactions producing ATP. So more of it's a cofactor of dehydrogenase enzyme. Okay, vitamin B1. Okay, so when you say ATP production, you need vitamin B1. Okay. Next, the disease that is associated. So, diba, first you have biribiri. Next is your Wernicke-Korsakoff syndrome. Okay, so for Wernicke-Korsakoff syndrome, it's a combination of Wernicke's encephalopathy and Korsakoff syndrome. So for Wernicke's encephalopathy, you have ophthalmoplegia. Okay, so it's the weakness of the eye muscle with double or blurred vision. The next is gait ataxia. That's abnormal, uncoordinated movement. Then global confusion, that's temporary episode of memory loss. Okay. So for Wernicke encephalopathy, it's acute. Okay. Then next, you have Korsakoff syndrome. Uh, if you have Korsakoff syndrome, you'll experience amnesia, and it's a chronic type. Okay, so acute for Wernicke and Korsakoff, it's chronic. So both are caused by deficiency in vitamin B1. Okay. Next, so regarding biribiri, let's go back to biribiri. There are two types of biribiri. You have infantile biribiri and the adult biribiri. So infantile biribiri usually happens in babies. The age is 2 to 3 months old. Okay, and the reason for this one is that the mother is deficient in B1. Okay, or you're using milk formula that lacks B1. Okay, so that's the cause of infantile biribiri. Next, for adult biribiri, there are two types. You have dry and wet. So if dry, it's more of related to neuropathy. Okay, so nerve damage due to vitamin B1 deficiency. And for wet, it's more of there's dilated cardiomyopathy and coronary, congestive heart failure or CHF. Okay, so for adult biribiri, there is abdominal pain or cramps, and the cause of this one, it's because of the lack of ATP. Okay, so that's why there's abdominal pain. Okay, and for neuropathy, you have demyelinization. Okay, now what are the causes of biribiri? Okay, so first is chronic alcoholism, because if you're chronic alcoholic, if you are alcoholic, then possibly you'll eat less food and drink more alcohol. Okay, and if you eat less food, you'll have deficiency in vitamin B1. Okay, next is severe malnutrition, dietary deficiency. Next is extreme dieting. So example of extreme dieting is you'll reduce your calorie intake to 500 calories na lang instead of your requirement nga 26 or 2000. That's extreme dieting, and it can cause vitamin B1 deficiency. Another is folate deficiency. So if you're deficient in folate, there's decreased absorption of B1. Okay, so it will lead to uh, biribiri. Okay, or vitamin B1 deficiency. Okay, remember biribiri. Next is vitamin B2. So it's essential, water soluble, has a solubility in water that is poorer than other vitamin B. Now, regarding sources, natural, you have food like eggs, fish, mushroom, yeast, green vegetables, liver, almonds, and dairy. For artificial, you have enriched grains, vitamin B complex supplementation. So regarding enriched grains, there are some government that impose that they need to produce enriched grains in order to avoid vitamin B deficiency. Okay, so for example, to prevent biribiri, so you need to add or enrich your product with vitamin B1 to avoid or to prevent increase in the number of cases of biribiri. Okay, and other vitamin B deficiency. Okay, so regarding riboflavin, it's needed in redox reaction, and it is a photosensitive substance. Okay, so the disease that is associated usually with riboflavin, it is arabinoflavinosis. It's uncommon except if the patient is severely malnourished, meaning for this one, there is decreased intake usually, and or there's a problem with the amount of riboflavin, meaning there's decrease in riboflavin. And uh, regarding increase of riboflavin, it's difficult or uncommon, okay, or rare to have hyper or increase in riboflavin. It's because it's a water soluble vitamin. Okay, so causes is decreased intake. So example, malnutrition. So due to abject poverty or extreme poverty. Anorexia nervosa. So anorexia nervosa is a psychiatric disorder where the person does not want to eat food because he's thinking or she's thinking that he is fat. Okay, even though that's not the reality. Okay, or he's fit or she's fit, but he's always thinking he's fat. Okay, and because of that, he will not eat food. That's anorexia nervosa. Okay, aversion from drinking milk. That's another cause. Another cause of arabinoflavinosis, you have normal intake, but there's abnormal metabolism. There's a problem with the absorption of riboflavin. Okay, so for the symptoms, you have inflammations of for glossitis, that's inflammation of the tongue; stomatitis, inflammation of the mouth; and cheilitis, that's inflammation of the lip. And there's also oily, scaly skin rashes at the scrotum or vulva, or nasolabial folds. So this is the nasolabial folds. Philtrum of the lip. Okay, so this is the philtrum, the canal. Okay, above your lip. Okay, canal that connects your lip to your nose. Okay, that's your philtrum. Another, you have itchy and watery eyes, and it can also cause IDA because vitamin B2 is important in the absorption of iron. Okay. Next, you have niacin or vitamin B3 or nicotinic acid or nicotinamide. So same with other vitamin B, it is essential, water soluble, and in higher doses, it's an anti-hyperlipidemic substance because it lowers VLDL. And if there's low VLDL concentration, remember VLDL is the precursor of LDL, so there's also decrease in LDL concentration. Okay. Now regarding tryptophan, you need tryptophan to form niacin, okay, or vitamin B3. So tryptophan also is important in the formation of serotonin and melatonin. Okay. So tryptophan is um, an important, okay, uh, amino acid. Okay, so without tryptophan, you cannot form niacin. Okay, but you can also eat food rich in niacin or vitamin B3. And if you want to form vitamin B3, then you need to eat tryptophan. Okay, so there are two ways to get vitamin B3: eat food rich in niacin or eat food rich in tryptophan. Okay. So regarding sources, natural, you have food, meat, fruits, vegetables, seed, cereals, and tryptophan containing food. For artificial, enriched food and vitamin B complex supplementation. And uh, most common cause of vitamin B3 deficiency is eating only corn-based diet. Okay, so if you only eat corn, majority of your food, every meal is corn, then you're prone to vitamin B3 deficiency because corn lacks tryptophan. Okay, so it lacks tryptophan, so meaning there's a possibility it'll have vitamin B3 deficiency. Okay, so that's a problem with corn. Okay, now the disease that is associated with uh, vitamin B3 deficiency, remember it's pellagra. Okay, so for pellagra, it has 3D. So the patient will experience diarrhea, dermatitis, and dementia. Okay, so usually the effects of vitamin B3 deficiency, um, it's present in gastrointestinal tract, brain, and skin. That's why there's diarrhea, dermatitis, and dementia. Okay, and if it is prolonged, okay, it can cause death to the patient. Okay, so what are the functions of niacin or vitamin B3? It's a cofactor for many dehydrogenase enzyme. It's a cofactor for many dehydrogenase enzyme, and it is important for DNA repair and cell signaling. And it's also important for metabolism. So it's usually present in metabolically active cells like skin, gastrointestinal tract, and brain. That's why the symptoms of vitamin B3 deficiency are usually seen in the skin, gastrointestinal tract, and brain. So for skin, you have dermatitis, diarrhea for GI, and dementia for brain. So why man nga ang patient will experience dermatitis, dementia, and uh, 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 dementia and diarrhea? It's because niacin is important in the production of energy via uh, TCA. Okay. So without niacin, you'll produce less energy. And that's why you'll exhibit those 3D. Okay? So that's for niacin. Next vitamin, it's vitamin B5 or pantothenic acid. So natural source, it's everywhere. Uh, Usually, majority of food contains vitamin B5. That's why it's all, okay, pantothenic acid. So artificial source, you have enriched food and vitamin B complex supplement. And regarding deficiency of vitamin B5, it's extremely rare because it's found everywhere or from any food. Toxicity is also extremely rare because it is a water-soluble vitamin. So your body can excrete it once there is excess. Okay. Now the function of vitamin B5, it gives coenzyme A. Okay. So that's for vitamin B5, pantothenic acid. Next is vitamin B6. So for vitamin B6, that's your pyridoxine. So artificial source, you have enriched food and vitamin B complex supplementation. For natural sources, you have food sources like meat, cereals, fruit, egg, vegetables, fish, milk. Milk is a poor source of vitamin B6. And your intestinal flora. So the function of vitamin B6, it's more of the activator of your transaminases like your AST and ALT. And it's also important in the production of neurotransmitter. Okay? And it helps in making arachidonic acid, niacin, histamine, and sphingomyelin. Okay? Now, it's associated with sideroblastic anemia because once you have vitamin B6 deficiency, okay, remember that in order to form heme, you need the combination of iron and protoporphyrin. Okay, so for protoporphyrin, okay, in order to form protoporphyrin, you need vitamin B6. Okay, so without vitamin B6, or if there's a deficiency in vitamin B6, less protoporphyrin will be produced. So meaning less heme form. But there are a lot of iron in your body. So it will accumulate. Okay? So there's accumulation of iron. And that's why there is sideroblastic anemia. Okay? So that's the explanation why vitamin B6 can cause sideroblastic anemia. So symptoms, you have peripheral neuropathy, okay, abnormal heme production. That's why there's sideroblast. So there's also abnormal heme production because of less protopor, protoporphyrin form. And there's also homocystinuria because um, vitamin B6 is also important in the conversion of cysteine. Okay, so if there is uh, vitamin B6 deficiency, that's why a patient will experience homocystinuria. Okay. Next, vitamin B7. So for vitamin B7, um, uh, it's called biotin, and function, it's cofactor for carboxylation reaction and protein synthesis. Okay. Now regarding the protein avidin, avidin is a protein in raw egg white. Okay. So the egg white nga raw contains avidin. And to remove that avidin, you need to cook, okay, the egg white. Okay? If you're eating raw egg white consistently, okay, or drink the og egg white, not eat, but drink og egg white, or bahala unsa na siya, basta if you ingest, okay, raw egg white for a prolonged period of time, it can cause vitamin B7 deficiency because avidin, which is present in raw egg white, inhibits the absorption of vitamin B7. Okay, so sources of vitamin B7, it's artificial source, you have enriched food and supplementation. For natural, you have food, fruits, vegetables, grain, egg yolk, not egg white. Okay, yeast and milk. Okay, so remember avidin. Okay, inhibits vitamin B7 absorption. So causes of vitamin B7 deficiency, you have consumption of raw eggs, okay, and malnutrition and decreased biotinidase. So for biotinidase, it's an enzyme that is important in the recycling of biotin, okay. So these are the causes of vitamin B7 deficiency. Okay, now next is vitamin B9 or your folate or folic acid. So it's essential and it's water soluble, but it is stored in the liver for 3 to 4 months. Okay, so function, transfer one carbon unit or in DNA synthesis. Sources for natural, you have vegetables, liver, kidney, yeast, meat, and fish. Artificial, you have supplementation, and it's absorbed in the jejunum. Vitamin C is important in the absorption of folate. Okay, so you need vitamin C to absorb folate. Okay, that's one of the functions of vitamin C. Okay, next, it prevents neural tube defect. Okay, so that's one of the important functions of uh, uh, vitamin B9. So example of neural tube defect, you have anencephalopathy. So meaning of anencephalopathy, you have incomplete formation of the brain, or there's a big portion of the brain that is absent, okay, not present. Okay, so the baby will have a small head, okay, it's because of the failure of the development of the CNS. Okay, that's neural tube. Neural tube is the precursor of CNS. And for vitamin B9 deficiency, it's associated with macrocytic anemia, meaning there's decreased red blood cells, but there's a presence of big red blood cells, big cells. And there's also pancytopenia, or decrease in all types of blood cells because of the deficiency in B9. Why? Because B9 is important in DNA synthesis, okay, or maturation of cells, okay. So that's for pancytopenia. Then there are megaloblasts, okay. So presence of immature big cells, okay. It's because of the lack of vitamin B9 because it promotes DNA synthesis. And the patient will experience or the patient is tired and pale. The reason is because of anemia, and we'll have angina, okay, or chest pain. It's because of less oxygen delivered to the tissue, okay, the cardiac tissue, okay. Then the patient is also exercise in there is also exercise intolerance, meaning the patient cannot do exercise because kapuyon din siya. It's because of anemia, okay. So causes, you have decreased intake of vitamin B9 or if there's malabsorption, and drugs like phenytoin, methotrexate, and trimethoprim. So these drugs usually inhibits vitamin B9 or vitamin B9 antagonist. Okay, so that's for vitamin B9. So it's associated with macrocytic anemia. Okay, macrocytic means big cells, but there's anemia or decreased red blood cells. Okay. So why man na big na immature nga cells? Because there's the deficiency in vitamin B9, which is important in DNA synthesis or development of cells. Okay. Okay, so next is vitamin B12 or cobalamin. Okay, so it contains cobalt, and the liver can store B12 for 3 to 4 years. So B9, 3 to 4 months, but for B12, it's 3 to 4 years. So it's water soluble, but it's stored in the liver for 3 to 4 years. And it is essential. Okay, it's a cofactor for isomerase, mutase, and it's also important for DNA synthesis. So sources, you have artificial, you have your supplements, so fortified food and multivitamin and cyanocobalamin. Natural, you have clams, mussels, beef, turkey, chicken, milk, eggs, mackerel, crab, salmon, rockfish, and liver. So remember that vitamin B12 is not present in vegetables and fruits. Okay, so if you're a vegetarian or if you're vegan, then you have high risk of vitamin B12 deficiency. Okay, because B12 is only or is present in meat. Okay, fish. Okay, seafoods and beef. Nana. Okay. Basta nasa sa meat. Okay? So, nasa sa beef, nasa sa pork, nasa sa chicken. Okay? So, nasa sa imong chivon. Okay? Or goat meat. Okay? So, if you're vegan, you're prone to vitamin B12 deficiency. So, remember, or no, not remember, but it's my opinion lang, no? There is no perfect diet. Okay? All diet can siya disadvantage and advantages. Okay? So if you're doing carnivore, keto diet, pescatarian, vegetarian, vegan, fruitarian, okay? Those diets, they have their own advantages and disadvantages. Okay? So if you want to have a complete diet, so eat kag vegetables, eat kag fruits, eat kag meat, eat kag seafood, for you to have or for you to have less risk of vitamin deficiency. Okay, but sir, um, meat can cause cancer. Okay, now regarding that one, my opinion lang, regarding studies about meat that is associated to cancer, there are correlation studies. Okay, correlation. Okay, that meat can cause cancer, but not causation. Okay, nga definitive yun nga. That's the cause. There's only correlation. Okay? So, for me, or opinion lang, it's because of processed meat. Okay? Processed meat can cause cancer. Okay? Or another is regarding cancer, you can also get cancer if you consume vegetables that are highly or that contains high levels of pesticides. Okay, so nowadays the vegetables that you can get or buy from the market, okay, those vegetables are highly contaminated with pesticides because a lot of farmers use pesticides in order to increase their production. Okay. So if you want to avoid that one, so you need to grow your own food. So in your backyard, plant ampalaya, sa pamanina, mga vegetables, other vegetables, plant vegetables, and grow some chickens. So that's how you lower your risk of cancer. But if you're buying vegetables from supermarket, uh, you're prone to uh, cancer lang gyapon. But there are vegetables and other produce that are uh, organic or naturally produced, but usually it's expensive. Okay, same with eggs. There are eggs produced lang via using layer feeds or layer mash. But there are also eggs produced naturally. Okay? So, or organically. So, for organic eggs, uh, they're expensive, but you can get a lot of benefits eating organic eggs, okay, compared to eggs produced lang via or way of using layer mash. Okay? So expensive, if ganan kag healthy, then usually it's expensive. Okay? So inana, usually expensive ang mga organic. And if you're producing eggs, ng organic, you need to be a certified producer of organic eggs. It's not just nga you'll claim nga you're producing organic eggs. No, you need certification. Okay, so if you're going to buy organic eggs, look for the certificate of that farmer. Okay, if he or she is a certified producer or farmer of organic eggs. Okay, hindi siya abi kay brown egg kay organic. No, you can produce brown egg through layer mash. Okay? So, or i-battery cage lang gyapon nimo ang chickens. Okay? Ang battery cage is kato ng gagmay nga cage nga. That small cage contains four hens. Okay? And you feed them lang with layer mash, and they only the thing that they're doing lang sa mga hens, uh, they eat, they lay eggs, and they sleep. Okay, that's their routine. And they cannot move. Okay? They cannot move. They don't have freedom in terms of movement. Okay? Kaya sila, grabe kayo sila ka ipit. Okay? And the reason why na ina nga type of production, it's because of commercial production. It's because if it is free range organic egg production, you need a lot of space. Okay? If you want to raise 100 or 1,000 chickens or 1,000 hens, then you need 1,000 square meters of land. But if you're doing battery cages, then you'll have small portion of your land lang that can contain 1,000 hens. Okay? So inana. So it's difficult to produce organic food and you need certification for that. Okay? You should not lie to your customers nga, this is brown egg, this is organic. No. That's not correct. Okay, you need certification that you're using organic food for your chicken. Okay, you only use um, natural medications for your chicken and natural vitamins. You're not using commercially produced medications and vitamins for your chicken. Okay. So, we'll not talk about agriculture na. Basta remember, you cannot get vitamin B12 from vegetables and fruits. You can only get vitamin B12 from meat. Okay. Next, B12 is present in of in food of animal origin only. Okay. So, and it's not present in foods of vegetable sources. Okay. So, remember that. So vitamin B12 deficiency, the patient with vitamin B12 deficiency is usually tired and pale. It's because of anemia. Then there's headache and angina due to high output uh, cardiac failure. Okay, so meaning your heart tends to pump more blood. Okay, that's why there's angina because there's a deficiency in oxygen. Why there's a deficiency in oxygen? Because the patient has anemia. Okay, so if there's vitamin B12 deficiency, it's correlated or it can cause anemia. Okay, so causes, you have your diet, not eat but diet. Strict vegan. Okay, if you're strict vegan, elderly, and if you're malnourished. And another, if there's salivary gland inflammation, okay, you cannot produce um, the enzymes, okay, the amylase enzyme needed in the breakdown of food. And if there's a problem with your stomach, you have achlorhydria, meaning absence of hydrochloric acid, hypochlorhydria, decrease uh, hydrochloric acid. And if you have pernicious anemia, where the autoantibodies attack the parietal cells, which produce intrinsic factor and hydrochloric acid. Okay? So you cannot absorb vitamin B12 if you have these diseases. Pancreas, if there's pancreatitis, or no, not pancreatitis, if there's no pancreatic amylase being produced. Okay? Then bacteria, if you prolong the use of antibiotic, meaning you kill the intestinal flora, okay, in your gut. Okay, that can also cause vitamin B12 deficiency. And in your ileum, if you have Diphyllobotrium latum, I think this is a tapeworm, and it eats your vitamin B12. Instead of your body absorbing it, the D latum is eating the vitamin B12 available in your gastrointestinal tract. And also if there's malabsorption syndrome. Another, if you're alcoholic, okay, so there is less absorption of vitamin B12. And another, if you're an alcoholic, there's a possibility that you're going to eat less but you'll consume more alcohol. This is applicable lang for chronic alcoholic individuals, ah. Okay? So that's for vitamin B12 deficiency. So for vitamin B12 deficiency, there's macrocytic anemia. Why? Because of the problem with the DNA synthesis. Okay, same with vitamin B9. The B12 is important for DNA synthesis. That's why there's macrocytic anemia, big RBCs, but in terms of numbers, it's low. Okay, so there's also presence of blast cells. Okay, so everything is big, immature, and stupid. Okay, it's because those blast cells, they're big, they're immature, but they're useless. Okay, why? They cannot perform the function of a mature red blood cell. Okay, the proper functioning of a red blood cell, a mature red blood cell. Okay, so presence of big blast, or there are megaloblast present. Okay, so if there's decreased vitamin B12, it can cause decreased cell division. Okay? So it can cause pancytopenia, meaning there's decrease in red blood cells, white blood cells, and your platelets. Same with vitamin B9. Okay? So that's for vitamin B12 or your cobalamin. Okay? So I think we're done with vitamin B na. Okay? Okay, so next is vitamin C. So vitamin C or ascorbic acid. So it's essential, water soluble. So it's difficult for a person to have hypervitaminosis C. Okay, but it's common to have hypovitaminosis C, or meaning deficiency in vitamin C. Okay, so it's water soluble, and the concentration of vitamin C that is needed by our body per day, it's 100 milligrams. Okay, so you can take 1,500 milligrams, but that 1,000 milligrams is it's too much for your body. Okay, so meaning if you take 1,000 milligrams of vitamin C per day, that's your vitamin. It contains 1,000 milligrams. 900 milligrams of that will be removed by your body. Okay, because you only need 100 milligrams. Okay, per day. Okay. So, regarding function of vitamin C, it's important for the absorption of iron. So, it converts Fe3 to Fe2. Okay. And Fe2, it's the type of iron that is being absorbed by our intestine. And it's an antioxidant and aids in the fibroblast, osteoblast function. So, it's important for development of our bone and connective tissue. Now, the disease that is associated with vitamin C deficiency have scurvy. Okay, so for scurvy, the patient will experience bone problem. Okay, there's also a problem with his connective tissue and also the blood vessels. So, a person with vitamin C deficiency is common to bleeding. So, if you perform katong blood pressure gani nga inflating mo for 5 minutes, the patient will have PTK. Okay, and another problem with scurvy, there's a problem with the basement membrane. So the gums is weak. Okay? So pwede nga maibot lang ang tango. It's because weak ang basement membrane. And another hair problem. So for example, straight kag hair, and if you have scurvy, curly na siya. Okay? So that's the effect of scurvy or vitamin C deficiency. Okay? So if you're vitamin C deficient, you're also prone to saan remember, bleeding. Okay? Because vitamin C is also important for the maintenance of your blood vessels. Okay? So if you have vitamin C deficiency, you're prone to bleeding. Okay? So that's the importance of vitamin C. Okay? But you only need small amount of vitamin C per day. Okay? And it's better to get it from food like or fruits like lemon, oranges. Those fruits contain high levels of vitamin C. Okay? So I think that's all regarding vitamins. Thank you and God bless.